Good afternoon. I don't need a microphone. Members of the board, citizens of the state of Iowa, I stand before you today as living proof that the medical benefits that marijuana can provide. Over 20 years ago, I tested positive for HIV, the virus that causes AIDS. At that time, there were no approved medications to combat the virus, and I was resigned to the fact that I would eventually succumb to the disease. Soon, drugs to halt the progression of the disease were developed, but they came with a price. They had severe side effects, including nausea, diarrhea, headaches, muscle cramps, fatigue, anxiety, and worst of all, insomnia. Where was the rigorous testing for these drugs that allowed them to come onto market before they knew everything they would do to my body? I know this is not a debate, so I'll stop with my rebuttal at that point. Soon, I tried to take these drugs as prescribed, but the side effects were too much. I tried everything to alleviate the side effects. I tried Tylenol for the headaches and muscle cramps, and soon after I started taking the maximum dose of Tylenol, my doctor asked me to please stop because my liver enzymes were dangerously high. I then switched to ibuprofen, and it caused so much stomach problems on top of the nausea and diarrhea that I already had that I had to stop using the ibuprofen as well. Other pain medicines such as opiates were never recommended or offered, and I thank God for that because I would not have wanted to go through what I've heard other people go through being prescribed opiates. I also used Marinol to try and combat the nausea. This was to no effect. It made my fatigue worse. That's all. In order for the antiviral drug therapy required to combat HIV to work, you must maintain strict compliance. That means taking the exact dosage at the exact time every day on time. I could not comply with that, nor could many of my friends who were also stricken with this disease. By 1994, my health had declined to the point that I was diagnosed with full-blown AIDS, and I went on disability. I was on Social Security, Medicare, and Medi-Cal, which is Medicaid in the state of California. In addition to my declining health, my sporadic attempts at maintaining the drug therapy had caused the virus to mutate, and the drugs were no longer effective in combating the virus in my body. I was about to give up hope. Then, in 1996, I was fortunate enough to work with Scott Imler, who gave me this pin. He was the co-author of Proposition 215 in California, the Compassionate Use Act of 1996, which we did successfully pass. And I was encouraged with this to try marijuana to alleviate the side effects of the medicine. I went to my doctor and got a new regimen, which also had very severe side effects. And I was able to alleviate these side effects through the use of marijuana. The marijuana helped me with nausea, with muscle cramps and the pain. It helped me with the anxiety, and most importantly, it helped me with the insomnia. With the help of marijuana, I was finally able to comply with the new treatment regimen, and my health improved to the point that I was able to return to school and finish my bachelor's degree. And I graduated in 2005 from Iowa State University with a 4.0 grade point average, all while using marijuana every single day. And members of the board will see the top article on there has to do with, it was the Dr. Kozlow mentioned this article. It has to do with how marijuana helps with adherence to the HIV regimen. I now have a full-time job and am no longer on disability. I'm not taking money from the Social Security pool, which is designed for our seniors and for people who really need it. I did need it at the time, but I got myself to the point where I could go away from that. I'm not using Medicare funds, Medicaid funds, funds from the Ryan White Act, which supply very expensive medicine for AIDS patients. I'm paying for for those through my private insurance from my employer. And I thank God for that. My journey is not over yet, though. The HIV virus does mutate very easily, and when it does, it renders the drugs that you're taking ineffective. Therefore, I've had to change my regimen several times in the last several years, and each time I've had to deal with a new set of side effects. I'd like to say that I've been able to conquer this, but it's been very difficult. I've not been able to maintain strict compliance like I did when I lived in California. Because, and even though my doctor who's treating me now does approve of my use of marijuana to combat these side effects, I have not been able to use marijuana because I cannot find a safe, reliable source. The only way I know to find marijuana is through the black market. And dealing with criminals is never a fun thing. Fear of prosecution also makes this option less than desirable and intensifies my anxiety. So today, I'm here, along with many others, asking the board to please recommend the removal of marijuana from its current listing as a Schedule I drug with no recognized medical value. It does have medical value, and I'm living proof of that fact. I speak to you today as a patient. I'm not a doctor or a scientist, but I know what works for me, and I know what works for many other people. I have seen after the passage of Proposition 215, I have witnessed many people who were at death's door. They were literally skeletons of their former selves. Once they were allowed to use marijuana legally, they began to gain weight, they were able to tolerate the drugs that they were prescribed, and now most of them are off of Social Security disability or whatever plan they were on and are working jobs and paying their own way. They aren't living off of the entitlements. For this reason, I must state that marijuana does have medical value. I do not use marijuana to get high. Of course, when I was a teenager, I experimented, as did probably many people in this room. But that's not my point now. I use marijuana to stay alive. So I ask again, please consider my story and those of others, and help us all to live happier, healthier, more productive lives by removing this plant which God has given us from the current Schedule I listing. Marijuana does have medical value. It has given me a second chance at life. Thank you.